chronic pain, neurological issues, and beyond. Right now, stem cell therapy is taking the medical field by storm. And the other day, I had the chance to learn why firsthand. Now, to be fair, we should warn you, some viewers may find the video graphic or a little bit disturbing because we did take the rare opportunity to watch a real patient try the treatment. Take a look. If you are in pain and have tried option after option and don't know where else to go, it might be time to consider stem cell therapy. Now, this is a buzzword that we're hearing a lot about lately, but it's important to know whether this is right for you. And today we're here at Precision Pointe Orthopedics in Draper with Dr. Randy Relier and, of course, one of his patients, Phil. And we're going to see this firsthand, how it all works and how to know if it's the right thing. Doctor, why is this becoming such a popular thing?
Well, you know, when I was trained, we were taught that everything is fixed with surgery. But we've found that as we get older, or even acute injuries when we're younger, it's a little more difficult to heal. They can become chronic. And if we can intervene earlier with something like stem cell, we can avoid having surgery.
And there was hope for Phil. He came in, what, a few months ago to work on your knees because you were having issues with those, right?
That's right. So I had tendonitis in both knees, above and below my kneecap, and it became chronic. I've had this condition for 10 years. When I was driving my sports car, it became problematic getting in and out and things.
Those are things at this age you shouldn't have to be worrying about, Phil. You should drive your sports car pain-free, and you actually now are able to do that. I understand that the pain has been improved, and now you're not back for your knees, you're back for something else.
Yeah, so I just have a little bit of back pain that I'm going to get tuned up here, knowing that I've gotten the results.
Well, I'm crossing my fingers for you and a little nervous, actually, because we're going to be here firsthand to see this process happen. You're letting us here in the patient room.
Absolutely. We want people to be educated and know what this is exactly about. And so there's no fear, but also to know that there's hope for them.
Phil, are you ready to do this?
I am, sure.
So we're going to get Phil on his stomach, and we're going to sterilely prep and drape him and get him numbed up and harvest some bone marrow.
Okay, we'll see you on the other side, Phil. Good luck.
This is the part that probably hurts the worst. We numb up the outside of the bone so they don't feel it when we go in. Okay. Now we're going to sterilely prep and drape him. So
let's go.
Here's the betadine, and then we'll harvest the bone marrow. So I'm a little more aggressive than maybe some. While I'm in there, I take up to 150 cc's of bone marrow. That allows me to have better stem cells, a better amount, a better yield, which allows me to treat sometimes more than one area at one time. So we take as much as we can get to get as many stem cells as possible. So I find that area we numbed up. I want to get right in the middle. Okay, so we're inside the bone marrow now.
We're pulling it out, Phil.
We take out what's called the trocar.
There it is.
And this acts like a little straw. And what she's aspirating out now is nice, healthy bone marrow. As soon as we're done harvesting, we'll put this in the centrifuge. And the centrifuge is probably the most important piece of equipment that we use. And it separates the blood components by weight.
Okay, so we're done with the first.
And then, using light cytometry, it's able to isolate and extract the stem cells and concentrate them into a syringe. And then we inject those back wherever they're needed.
Isn't technology so incredible? There we are at the end of the procedure. So what you didn't see is they used their fancy machine, right? The stem cells were able to get separated, and then they injected them back into Phil's back. He took it like a champ, and there we all are. I mean, he was out of there within, gosh, I want to say 30 minutes, start to finish.
I know some of that tough maybe for you to watch when you see the needle.
But it's so cool.
What I do love about it is we've talked about stem cells now on the show several different times, and to see the process and to see what you go through and look at him in the selfie right after. I mean, he could go to work.
He was
after
in and
that
out.
process.
Yeah, he actually works at a hospital.
I think is so
himself.
interesting.
And I love that Phil allowed our cameras to go in and film this whole procedure. But both he and Dr. Relier were very, very adamant that we spread education and awareness that it's just super simple. Anyone can do it, and it really has been known to change lives.
If you are in pain and you're thinking, do I need surgery? This is worth looking into. This is worth asking questions and seeing if it's right for you.
Right. Exactly. And so we'll link you to all the information, of course, from our website. But this is Precision Pointe Orthopedic and Sports Medicine. The information right there on your screen, and they are located in Draper, just there at the point of the mountain. True professionals. So really, really excited to have had that opportunity.
All right, so we'll come at the end of the show, everybody. Gross